We're here with Debbie Valentine from Integrated Medical Services. We're gonna just find out a little bit more about Integrated and your company here. So tell us a little bit about what you do here.
Well, we are a full-service primary care provider. We have a physician, Dr. Danny Werwood. There's me, Deborah Valentine, nurse practitioner, and Zach Fisher as a PA currently. We're constantly growing, so hopefully we'll be adding on to that. We do full primary care, the whole age group from birth till death. We can do remote patient monitoring, which allows us to track blood pressures, glucoses from the home, and the information is sent directly to us. I'm a certified diabetes educator, so I can work with people with their diabetes and help get them under control and reduce those risk factors. We also do home visits for homebound seniors in nursing homes, assisted livings, and even in their homes where if they're too frail or too weak to get into the office, we can go out and actually see them in their homes as well. And we have a great atmosphere here, great camaraderie. We're hopefully very welcoming and friendly environment. And we're looking to let people know we're accepting patients and we're looking to grow. We are not corporate owned, we are private. So we are truly a small town business.
Good, that's really good. So do you find it's helpful to help with the current state of things right now? Going to people's homes, do you think that's even more helpful now than it was probably 5 years ago?
I think it would be always helpful. How often have we heard, oh, grandma and grandpa have to go to the doctor and they have to get a wheelchair and then they have to help them get them in the car and then they have to help get them in the building and then they have to get them back out of the building and then get them back in the car. Then get them back home. And for anybody who's lived that knows how taxing it is, and by the time grandma and grandma get home, they're exhausted for the day. And to be able to come in, I get to see them in their own habitat, which is a little more honest presentation than what they may present to me too. I get to see a little bit more of their environment and risk factors. Do they need physical therapy to help even get them around their home? Things like that. Do we need to get some home health services in there to take care of them? So it really gives me a much better assessment of what's really going on.
Okay, good. And you mentioned you're a nurse practitioner, so have you always wanted to be a nurse practitioner your whole life, or did you have other goals and dreams too?
Once I decided I wanted to be a nurse, which happened not quite when I was a young woman, it happened after my kids were born. I knew as I got more confident in my skills, I'm like, I think I can do more than this. I think I can do more than this. And so I got my doctorate degree from the University of Utah, and even now I'm like, ooh, there's always learning to do. But I'm working the best I can with what I have, and I love learning new stuff. Every time science comes out with the new information, it's like, oh, okay, this is what we're doing now.
Yeah. Do you keep up to date a lot on that?
We have to. Yeah. Okay. We have continuing medical education requirements that we have to meet, and being a diabetes educator, a lot of what I study is diabetes related. But as a primary care provider, I try to keep up with everything as best as I can. But if someone has a question that I'm not familiar with, we'll find the answer.
Okay, well good. In terms of the clinic here, is there anything special that you guys have here that makes you stand out, or things you want people to know about Integrated Medical Services?
I think the mobile clinic that we offer is unique because it's not found in most primary care offices. The remote patient monitoring and chronic care management that we offer helps give us a little extra special attention to people. Maybe they have elevated blood sugars and we're trying to track it and trying to figure out why is it happening, when is it happening. We have meters that have cell data that will automatically send us the readings after it happens so that we can then say, oh, okay, it's after dinner. Okay, we know how to fix that. Blood pressure regulation, we can track the blood pressure and see where it's going. And it's like, oh, you know what, why are they out of range today? We can call them up and say, hey, oh, I forgot to take my medicine. It's like, okay.
Here's the reminder, right?
It's not a heart attack, it's just a forgetfulness. We can deal with that.
Yeah. Okay, let's talk about some more questions here. We got, what is the most memorable experience that you've had being a nurse practitioner?
Oh, I don't know if I have a more memorable ones. My favorite thing is just getting a bond with the patients and knowing them and not having to just look at the chart to know them, to actually know them and their health issues. If I bump into them in the street or whatever, I can say, oh, Carol, how are you? And kind of really get to know them. And that's my favorite part about it. It's just knowing the clients, the patients.
Okay. So you talk a lot with clients. I'm sure you go through a lot of different things that you say to them at the end of every discussion. What's your favorite piece of advice that you like to talk to them about?
Well, it probably depends on what is going on in their life right now. If they're struggling with depression, my advice is going to be a little different than if it's their heart disease or their diabetes. But generally, try to promote a healthy lifestyle. It doesn't mean I want, an obese woman just to train for a marathon, but if you could just start eating more vegetables. Don't worry about cutting out the sugar. Don't worry about cutting out the junk food. Just make a point
a little bit more healthy.
It makes baby steps, and small corrections over time will lead to bigger and better improvements. And so just being aware and intentional in how you treat your body and what you do is really probably the best advice I could give. Is don't worry about making drastic changes. Make baby steps in the right direction until you get to your goal.
Yeah, like baby steps across the hall, baby steps to the kitchen, baby steps to eating healthier lifestyle.
Add a serving of vegetables every day. Add a serving of fruit every day. It doesn't mean you can't have the hamburger, but maybe have a salad instead of the fries.
Right.
Or a diet soda instead of a regular soda. Better get water. There's an option, right?
There's a thought.
Yeah.
So speaking of French fries and food, do you have a favorite local restaurant that's here in town or in the area?
I am a foodie. You tell me what kind of food you like, and I can tell you where the good places are.
Okay.
So Mexican locally, I like Ermitas.
Okay.
But if you're in Hurricane, I like Lupita's. If you're looking for finer dining, I love Cliffside.
Cliffside's nice.
Love Cliffside. If you're looking for bakery, I like Farmstead Bakery.
Yeah.
Love to get treats there in the morning for the office. Super impressed with their quality of foods.
Is that the one over by Jewel Plaza?
Yes.
Okay.
Yes. You can bring me croissants. From
Yeah.
there sometime.
Oh, okay. I'll bring you some of those.
Yeah, that's it. It depends on what you're looking for. We're really improving in our food options in St. George. When I first moved here, I was less than impressed with our options, but we've got some cool stuff. If you're vegan, there's Gaia's Garden, which has amazing options. Even if you're not vegan, it's really good stuff.
Yeah.
Okay.
All right. So as we talk about food, community things, do you have a favorite community event that happens every year that you like to go to?
Peach Days in Hurricane.
Mm-hmm.
And St. George has a George Fest kind of regularly. And that's always fun to come to and just walk around and see the food trucks and see the vendors, and sometimes they have little shows there. That is something that I always enjoy. That's not just an annual thing. It's kind of
a regular thing.
Mm-hmm.
Yeah. I know for me, I like to go to the movie night in a park.
Oh yeah.
So during the summer when they throw on a movie and everyone just comes and watches, it's fun to get out and be part of the community, but also enjoy a nice movie.
Those are fun too. Yeah. Mm-hmm.
Well, good. Well, thank you for talking with us.
No problem.
We're very excited to have integrated medical services here, and we hope that the business grows and everything works well for you guys.
Sure. Come see me.